Welcome to DeltaCast tutorials. Today I'll be applying a Volar Splint that's removable, okay, using Ortho-Glass. So with this particular application, the reason why we want to make it removable is on occasions the patient doesn't have an acute injury, but they have something that's a little bit more chronic and they need to remove it for daily living, i.e. just so they can shower and need it only when they need it, okay? So with this particular application, the injury is concentrated in the wrist area. So they may have a sprain or some ligament injury or just some chronic muscle pain in that area. So for this particular splint, we're going to have that patient position in neutral to about 20 degrees of extension, okay? And then far as how far distal, how far proximal this splint will be applied, we're going to be concentrating on the distal palmar crease of the patient's extremity so that we can have full range of motion for the patient so they can bend their fingers. But at the same time, we're going to put it proximal enough so that she can bend her arm at least 90 degrees so that it doesn't inhibit any movement so much so that she can do whatever she needs to do or the patient needs to do what they want to do, okay? So first, we'll just do the normal stuff. We're going to make sure that there's no jewelry on the patient that they wear with this splint because we're going to put something on there that's going to compress on their extremity. And you don't want any vascular compromise for the patient. So no jewelry, and just mark it, any injuries that the patient may have also. So first, what we'll do is measure the extremity. We'll use the uninjured extremity to measure on the patient. So with that being said, I'll just grab my padding, and you can use padding just to measure, or you can use a tape measure for the patient. So I'll just get some of my padding here. And I'm going to apply it on the patient's extremity, the uninjured extremity. So I'm going to use that arm here, and I'll put this at the distal palmar crease, and then put it all the way down to about 1 or 2 inches from the antecubital space, okay? But again, allowing for full range of motion of at least 90 degrees for that patient, regardless of the patient's size, okay? So I tear that off. That's my measurement. And now what I'll do is just put that aside. And now we're going to apply the Ortho-Glass. And of course, this is going to have an exothermic reaction. So it's going to get kind of warm on the patient. So let the patient know so they won't be alarmed. And let's go ahead and get our Ortho-Glass. And I'll be using this particular size because we want to make sure that it covers at least half of the extremity. So for most patients, we're going to be using a 3-inch or a 4-inch for the coverage of half of the diameter of the patient's extremity for support reasons. And I'll be using some elastic bandage just to apply it and keep it on, okay? So with this, we're going to go ahead and measure. We already measured, I should say. And we're going to take this little clasp off. And we're going to make sure that we take this off and put it back on immediately after we cut the product. This is a brand new package, so I'm going to make sure that I find where the splint is, and that's going to be where I'm going to cut it off. So the biggest things I want to concentrate on is making sure I don't leave any sharp edges hanging out that can disturb or cause a little more irritation to the patient's arm. So what I'll do is use my Ortho-Glass scissors and go ahead and cut that off. So if I'm going to cut it down, I'll give myself just a tad bit more. If I'm going to pull the padding past the substrate or the fiberglass itself, then I can cut it exactly how I want it. All right. So I'll quickly close this up. Now, this is going to set up with air. We do not want that to do that, so we're going to make sure we close it off. So first, just to close it off, we're going to just go ahead and push it down inside the package. And we're going to seal this off. So with that being said, make a nice little seam there, little crease. And I'll get my little closer, and I'm going to have this in an upside down T motion, and I'll put that directly in that little crease and close it down. And there we have it. So we're good to go on this. So pull this out the package. And this is how it's going to look. Have the padding on the exterior portion there. And what we're going to do next is we're going to form this. There's 2 different ways you can do this, but we're going to make it a little bit more comfortable for the patient. So we're going to peel this like a little banana, if you will, and it has this seam inside, so it's going to stick back together. So we can pull this down, and what we're going to do next is go ahead and cut it at an angle. This is from the open end. Okay, and that's going to contour to the groove of the distal palmar crease. All right, and so then what we'll do next is just go ahead and cut this down, make a little half moon shape for the thumb. And that's going to be the range of motion for the thumb. So now I close that back up, and I'll make sure there's no sharp edges or anything but the fiberglass hanging out of the edge of the splint material on both ends. Next, what I'll do is the area where I cut out for the thumb, I'll just cut a little smaller half moon out of the area, being cautious to make sure that the fiberglass doesn't hang out the edge of that area. Okay, just like so. So there's no fiberglass hanging out of the edge here. Now let's go ahead and apply some water to this. Once I wet this, it's going to set or feel like a cardboard within 3 to 5 minutes. And then after 20 minutes, it's going to be really rock solid and cured enough so that the patient can actually wear this, period, and the patient can be discharged and take care of what they need to take care of. All right. So let's get some water here. And the water temperature should be tepid or cool to the touch so that when the patient has the warmness feeling that it doesn't get too intense. So I'll just put this inside the water just a little bit. And then what I'll do is just roll it up on itself to distribute the water. Grab a little towel here. And put this directly on the towel there and just roll it up on itself. So here we go. We have a splint ready to go. Just kind of smooth out any wrinkles of sorts that may be on the splint itself. And then let's go ahead and apply this on the patient. So I'll just open the patient's hand up, place that inside the hand, okay? And then we just apply it on the wrist area and go around there gentle. We're going to go from the wrist to the hand, back down to the forearm. No need to put this too tight. If you pull in too tight, if you can kind of see through the elastic bandage, more than likely you're pulling a little bit too tight. So ease up on your pull as you apply this. And put your hand just like that for me. And so we're going to make a little hole for the thumb. And so I'll just pinch it here. And any extra padding, if you will, that may be hanging out, I can just roll this like this. Now, if you don't want to put a hole in it, you can just go ahead and just fold it in itself or use a 2-inch. This is a 3-inch elastic bandage. You can use a 2-inch also. So then I'll work my way proximal, ease up on my pull. What I'll do next is just cover this 50% every single time I go around. So every revolution around, I cover 50% of what I just put on. And with the extra that I have left, I could either just cut it off and tape it, or I can just use the rest of this and go back distal toward the hand. Now let's position the patient. So I'll grab the patient like I'm just trying to arm wrestle the patient, put my palm in their palm and one hand below their wrist joint and just put gentle pressure there and get that position that patient needs to be in, neutral to 20 degrees of extension, and just hold it there. Depending on the patient's maturity, if it was a child, you have to hold it till it totally cures, 15 to 20 minutes. But if it's a patient that you know is mature enough to hold the position, once you get them in position, tell the patients just stay there, and then you return to make sure that it's fully cured. Lastly, what I'll do is just go ahead and just pull this down a little bit to kind of neaten it up for the patient to allow for good range of motion for their fingers. Today, what we applied is a removable Volar Splint so that the patient can take it on and off or don and apply it only in the evenings or when they need to, especially they can take it off so they can shower. But the big thing is understanding the dimensions of that splint. Again, we applied it to the distal palmar crease all the way down to 1 or 2 inches from the antecubital space, but allowing for the patient to bend their arm at least 90 degrees for anything that's short on the patient. If you need any additional support or training regarding DeltaCast products, contact your local rep or look for us on www.essity.com.